I'm Dr. Amol Gupta, and I want to thank you for joining me on another episode of Medicine Mentors, where we interview masters in medicine, leading physicians at the top universities across the United States to learn from their experiences and derive key insights, traits, and best practices that can guide medical students and residents. Today we're speaking with Dr. Danielle Jones, who's an associate professor of medicine at Emory University School of Medicine. She serves as an attending physician for both the inpatient teaching services and the primary care center, and is the medical director of the Musculoskeletal Procedure Clinic at Grady Memorial Hospital. Additionally, she's an associate program director for Emory's internal medicine residency program with a primary focus on ambulatory education. Dr. Jones is a member of Emory's Academy of Medical Educators and also directs Emory's Primary Care Consortium. Having taught trainings at multiple levels, Dr. Jones is a huge proponent of mentorship and sponsorship, continually mentoring students, residents, and faculty at Emory and beyond. Dr. Jones has won numerous awards as an educator, including multiple learner-nominated awards, the Southern Society of General Internal Medicine Clinician Educator of the Year Award, the Emory Department of Medicine's Silver Pair Mentorship Award, and most recently, the Emory School of Medicine Mentoring Award. Dr. Jones is an active member of both the Association of Program Directors of Internal Medicine and SGIM, serving as the co-chair of the SGIM Education Committee. Thank you so much, Dr. Jones, for giving us this opportunity to learn more about your life story and experiences.
Thank you so much for having me. I'm happy to be here.
I want to start by asking you and talking with you a little bit about success. How do you define success, and what does success mean to you in perspective of your own life?
In terms of success, it's really different for different people. But the way I look at it, for me, is feeling happy with where I am and in the direction that I'm going, and having a good impact on those people around me. One of the things I think that's been probably the biggest secret to my success, I wouldn't literally be where I am without many mentors along the way to help me here. And I wouldn't be happy and feel successful where I am now if I didn't have the opportunity to mentor those around me.
What does mentorship mean to you? And what are some of the changes that you've seen in mentorship over the years? Is it going in an upward or a downward direction?
I would say mentorship has grown and maybe had a slight addition to its definition in that we now talk about both mentorship and sponsorship. So I think that mentors are people who take an interest in what you're doing and help you grow. And it may be areas of growth that you're setting as a goal for your own self. And it also may be areas that they identify that you need to grow in. And so a really great mentor may be telling things both you want to hear and maybe that you don't want to hear. I think in terms of sponsorship, where the direction of mentorship has sort of grown over the last few years, is that somebody is not just helping you move along, but is also looking for opportunities for you and actively helping you engage and grow into those opportunities. One of the things that we have seen over the years, especially when we talk about women and underrepresented in medicine minorities, is that we have what we would call a leaky pipeline. And so while we have a lot of folks entering into medical school, when you look in leadership across the board in medicine, you don't see as many URIM or women faculty members leading departments. And we think that one of the things that will really help is not just mentorship, but that sponsorship where you can reach down and actually say, I think this is a good opportunity for you, and help someone grow into that opportunity.
Can you talk a little bit more about this leaky pipeline? And specifically from my discussions with Dr. Jada Busi-Jones and Dr. Stacy Higgins, they really talk about how Emory has this proactive focus on closing the leakages and promoting minorities and underrepresented groups.
Yeah, so I work with Dr. Busi-Jones and Dr. Higgins in some of these areas. And it is true that when you look at the statistics, as I mentioned, what you'll see is that if we just use women as an example, at least 50% of most medical school classes entering will be women, but fewer than 9% are department chairs. And that's Department of Medicine. So those vary along specialties, but in the Department of Medicine, you're seeing, that obviously we're losing people along the way. And there are a lot of reasons why that may be the case. I think that you could probably write volumes on each one of these, but among many of those would be that people are not getting promoted because they may not, especially in the case of women or underrepresented in medicine, faculty members, they may not know that they are qualified. And so a lot of times there's a comparison made where somebody may not feel that they meet every criteria, and then they may not put their hat in the ring. They may not be getting enough mentorship to know that sometimes people grow into their leadership roles. And so one of the things that we have done at Emory is actually set up within a division that I share in general internal medicine with Dr. Higgins and Dr. Busty Jones and others, is that we actually review our faculty members every couple of years to see where they are in terms of promotion, with a specific focus of saying, you know what, you may be able to go up for promotion in 2 years just by the timeline, but if you're not ready now, this is what you need to do to get ready. And we are very specific in our advice in how to help people grow and what they can focus on to make themselves ready. And as I'm sure they've told you, we've actually had quite a lot of success in making sure that all of our faculty, but particularly our underrepresented in medicine and female faculty, are actually moving forward. And we have more women professors than any other division. And we also have more women professors of color as well, especially within Emory. And so it's something that we're very proud of and something that we continue to grow as a program.
Can you talk about the actual mentoring exchange? So a mentee and a mentor meet. What are the things or the tools that we can give to each of them to really optimize that 30-minute communication so that both can achieve the goal or the purpose for which these relationships are formed?
I think there are a few things that are probably basic to each of those encounters that you need to do. And I think one of them is sort of assessing what the faculty members' goals are, what their successes are, what the nature of the mentoring relationship is. What is it that you want your mentor, if you're the mentee, to be holding you accountable for? How specifically do you want them to be helping you? And what goals do you want to set across a wide span of things? Not maybe it's a personal faculty development goal, maybe it's a promotion goal, maybe it's an educational goal or a scholarship goal, but being very specific as your mentee to ask the mentor for help in those areas. I think in all of those areas, you want to make sure that you have defined that relationship, what it is that you're trying to achieve with each other, and how you can hold each other accountable. And also, it's always a good idea to talk about what to do if the mentoring relationship isn't working.
Now, some students, right? So the two students go to the same mentor. One student is going to get a lot out of that relationship, and one won't get as much. What have you found to be that difference?
I think of that sort of in terms of what are maybe the traits of successful students in mentoring relationships or students and residents. First is that you're organically recognizing that mentorship is important, so that you're going in a growth mindset. Because whether it's feedback or mentorship, or it's a mentor giving you feedback, or perhaps it's you're attending on the wards or in your clinic who is attempting to give you feedback or to help you grow, if you're not in a growth mindset, it really doesn't help you. And while we all like to hear that we're doing a great job and just keep doing what you're doing, that doesn't really make us better. And I think when you think about a mentor, you're asking to set goals with a mentor to make yourself grow and to be better. And so I think that oftentimes a difference between those two scenarios could be that somebody's really going in there with a growth mindset and being specific about what it is that they're trying to grow in, being thoughtful about what goals they're setting for themselves and what they're trying to get out of that relationship. I think the other thing is just as a mentor, as a mentee, setting expectations is important. Even as a team leader, again, going back to an example of as you go through and you become a team leader on the wards as a resident, doing something like setting expectations to your group can really help others grow. Telling people what you're expecting is the best way to make sure you get it. So I think, setting expectations is really important. As I think being proactive, so seeking out not just the mentorship, but being proactive about setting up regular meetings, trying to anticipate when you might need particular help. If you're working on a project, let's say, that someone's mentoring you on, knowing that you always struggle with a particular part of your project, when you go in, that's very helpful if you can be proactive and say, I think we should meet in 3 weeks, because whenever I have to sit down and start writing, I struggle. And it may be helpful if I can have a deadline with you so that I can look over, for example, you can help me look over my outline for my next project. And I think those kinds of, being proactive and being specific and understanding your own limitations can be helpful. I think also just being a good communicator. You want to be able to be open, with your mentor. And I think that goes back to the very first thing, which is being in that growth mindset, being willing to share things so that you can grow and make yourself a little bit vulnerable so that someone knows how to help you.
A lot of people that I've talked to, I would really say I've seen really 3 versions of mentorship being talked about, right? So there's one is I have one mentor and this person has played this amazing role in my life. The other is I have this network of mentors where I reach out to somebody for research, somebody for work-life balance, somebody for X, somebody for Y. And then this third section where I have more of this peer-to-peer mentoring, right? What you've seen work most for you?
Yeah, I 100% would fall into that group that believes that all of those are important. It's rare to find a mentor who can spend the time with you to help you grow in every aspect of your career. I've always had a different mentor for scholarship, which is an area that I particularly have needed to grow in. I probably wouldn't talk to you about my vulnerabilities and my teaching on the wards, but when it comes to I need to figure out how to get this paper published, he can tell me everything I need to do. And even if it's not an area that he's really done a lot of research in himself. And so I think that you may find somebody who is really skilled in that one area, but that person may not be able to give you the advice you need for how to grow your teaching skills. I have a lot of peer mentors who I feel hold me accountable for things a lot. And so one of the things that we'll do oftentimes is set up meetings, even if we're not working on the same projects, to actually help us make sure that we're staying on task with projects that we're doing and to give each other feedback on those projects. So if you have an area that always sort of seems to fall to your bottom of your to-do list, for me, that's oftentimes publishing papers. I have all these ideas, but the actual sitting down and writing is a struggle. Then I actually have some peers that have the same struggle, and then we hold each other accountable, somewhat like some people might for going to the gym. And so I think that, different mentors can play different roles, but you may find somebody who can fulfill several of those roles for you. But a lot of times when you have these unicorn mentors, a lot of people are looking out to snatch them up. And so they can get really busy. And I think it's good to get the perspectives of a lot of different people.
I really like the analogy of mentorship and peer mentoring and the accountability of peer mentoring, like going to the gym. Coming back to when we talk about medical students and residents, you touched upon a few critical traits that successful students have when they approach these mentoring relationships. What's one thing that you wish you knew when you started medical school or residency that you really want everyone listening to take to heart and practice?
It's always hard to put it down to one thing. I must say, I wish I had been more adventurous, and I think that's good advice to those to consider projects or opportunities that you encounter that you might not have necessarily considered. I think that oftentimes that early exploration can expand your experiences. Being adventurous and considering things that seem a little outside of the box for you is always a good idea. And then, of course, the other unicorn of medicine is balance. I think it's really important to find your center and to figure out what your outlet is. Because when you take better care of yourself, you take better care of patients and also, of course, everyone around you.
This was really great, Dr. Jones. You've shared some key pearls of wisdom with us, and I want to summarize them into a couple of points that I think we can all take away from this conversation. The first thing that I realized during our discussion is that we should view mentorship as a global solution, where it's beyond just getting a research paper published. It's really about helping us find our strengths, finding balance in life, keeping us accountable to the goals that we've set for ourselves, and help us access a broader team of professionals that can expand our vision for our own career trajectories. I'd say the second is about being proactive. in embracing mentorship. And Emory is a prime example of how becoming proactive, there's this dramatic, quantifiable impact of mentorship in resolving gender disparities, minority disparities, when it came to climbing the professorial ladder. So, it works. We just have to make the effort. And I'd say the third thing is that we want to get into mentoring relationships with a growth mindset, rather than going in to get a pat on the back. We're approaching our mentors with the question, how can I do better? And I'm really grateful to you for coming on and sharing this wealth of wisdom with us. Thank you so much.
Thank you for having me.
To our audience, thank you for tuning in with us here on the Medicine Mentors. Thank you for joining us as we learn from the masters of medicine.